directly comes to how will we actually evaluate the case of osteoporosis. Definitely we have to take the proper history of the patient. So what history? About patient menopausal history, family history, is underlying having any systemic condition that causing the secondary osteoporosis or not, underlying any medication that already taken for his or her another condition, and then after features. I already told that osteoporosis is an asymptomatic disease, but incidentally patient sometimes comes with the fracture. So symptom actually not appear until fracture most of the time. Patient have the fragility fracture. What is fragility fracture? Patient get developed fracture even in minor trauma. And actually the osteoporotic fracture site is in the distal end of the radius, which actually patient present with the collis fracture we know, and the vertebral fracture, and the most prone site is the T8 to L3 level, and the hip fracture. So what is the common site for the hip fracture? The hip neck and the intertrochanteric line. So when we get the examination of the patient, so we found that patient has loss of height. How the loss of height is created because of the hip fracture and the vertebral fracture, compression fracture in the vertebra. And even patient height is can be reduced, exceed up to the 40 centimeter. We can even find patients low BMI, thoracic and spinal kyphosis, which is called the Dowager's hump. Dowager's hump, what is this? It is actually happened due to that vertebral compression fracture as well as the multiple level vertebral fracture. Patient get this Dowager's hump or the Dowager's hump, whatever this. Whenever we palpate the patient's spine, we will get the tenderness over the spine. And whenever look for the range of motion, patient range of motion will definitely markedly reduce. So this is a tool which is actually invented by the World Health Organization, Collaboration Center for the Metabolic Bone Disease at Sheffield University in the UK. And they invent this tool, I mean the fracture risk assessment tool. By using this tool, they can say that how much the patient get developed, what percent of patient get developed in last 10 years fracture risk. So after this calculation, whenever patient, the fracture risk assessment tool, the percentage is 10%, that is low risk for development of osteoporotic fracture. Whenever this percentage is 10 to 20%, the risk is moderate, and whenever this percentage is getting more than 20%, then the fracture risk or the fracture risk is high, or I mean the severe score. So here's some imaging of the lumbosacral spine. First of the normal lumbosacral spine, even though it is not looking normal actually, the picture resolution. This is the osteoporotic fracture vertebra, in where you can see that the upper and lower end of the vertebral end plate getting concave, and the vertebral bone density, you can see density is reduced, and at the level of the 5, 4, 3, 2, at the level of the lumbar 2, it's getting compressed. So what are the findings when we send a patient for a lumbar spine and getting this? The concavity of the vertebra, this appearance of the fish-like mouth appearance, reduced bone density, and as well as compressed vertebral fracture. This all goes favor for the osteoporosis. Some other investigation we have to do, that is a complete blood count, some biochemistry, that is renal electrolytes, liver enzyme, blood urea nitrogen, creatinine, calcium, total protein and albumin, alkaline phosphatase, phosphorus, vitamin B12, vitamin D25 hydroxy, parathormone, serum protein, electrophoresis, thyroid function test, and 24-hour urinary calcium marker for bone resorption and urinary NTX. So actually investigation comes from that point whenever we keep on mind the differential, what are the cause or reason behind this osteoporosis. That time we can easily investigate patient in this way. So most of the time I utter that the bone mass, because the osteoporosis related with the bone mass or the bone density. So how can we measure this? The most practicing method, that is the dual energy X-ray absorptiometry. I will not go rest of this because these are not practicing in our country. So what is dual energy X-ray absorptiometry? It is actually for the measurement of the bone mineral density, and which is the key for the diagnosis and the confirmation of the osteoporosis. And where actually the dual energy absorptiometry focus, that is the hip, the vertebral body, as well as the forearm. So we get the two terms. One is the T score and another one is the Z score. So we have to clear conception about what is the T score and what is the Z score. So T score is the how my bone mineral density, that is compared to optimum peak bone density for younger gender. And the Z score is that shows how bone mineral density that compares to the bone densities of others who are the same age, same gender and the same ethnicity. So this is World Health Organization diagnostic categories for the osteoporosis. We all know about it. So when we call that this patient is not osteopenic, osteoporotic, or osteoarthritis, something like that, whenever the score is -1 plus above, that patient is normal. And when we call that patient is osteopenic after getting the BMD, when the BMD T score range is from -1 to -2.5. But whenever this ranges from -2.5 to above, that is the osteoporosis. So what are the benefits that we can get from this DEXA or the BMD, and what are the risks? So benefit is the weak or brittle bones to help predict the odds of future fracture. So whenever we know that our bone is very brittle, we have to very carefully take care of our bone that time. Determining if bone density is improving or worsening or staying at the same time. It is actually for the patient getting already treatment for the follow-up result. Can help you and your healthcare provider come up with plans to improve your bone strength and prevent worsening condition. So what is the risk? Risk is very simple because it's radiation exposure, but the radiation exposure is minimal, so the risk is related to the radiation exposure, and that is very minimal risk to patient can development of the cancer.